One study showed that patients only recalled 40% of the information they were given in the hospital, and almost half of what they thought they remembered was incorrect. This is why effective communication can be so important in the healthcare field. According to the 2010 National Healthcare Disparities Report, patient-centeredness encompasses qualities of compassion, empathy, and responsiveness to the needs, values, and expressed preferences of the individual patient. Some barriers to good communication include language. Most people in the US are fluent in English, but some solely speak Spanish, where there are a lot of healthcare providers that cannot. This makes it more difficult and more time-consuming to go over diagnoses and test results. Culture is another example. Some different cultures show pain in different ways. Some people have extremely low pain thresholds, while others could be 10 out of 10 level of pain and you would not even know it. Education level is another barrier in communication. Medical professionals use medical terms like everyone's supposed to know them, when in reality, most patients in the hospital have an elementary to middle school education level and need to be spoken to using plain language. Time is also another barrier. There are many patients to be seen, hospitals are short-staffed, and it is difficult to spend enough time talking and listening to the patient. To assess if effective communication is getting better or worse between healthcare providers and patients, I've compared 2006 and 2011 statistics on adults whose healthcare providers always listened carefully, explained things clearly, respected what they had to say, and spent enough time with them. As you can see by the charts, the numbers have not changed much, which is why effective communication needs to be addressed. Conducting assessments on each patient at the point of care is an important thing being done to improve an effective communication. This means assessing their culture, literacy level, barriers including hearing loss and vision loss, and adjusting their care accordingly. Teachback is another thing used. Teachback is when we teach the patient discharge instructions or really any instructions about diagnoses and tests and have the patient repeat back in their own words what we said to them so that we can ensure that they understand. What isn't working is rushing through things, not allowing patients to ask questions, and failing to use open communication. Another thing is using fancy medical terms that the patient doesn't know. Like I said earlier, most patients only have an elementary or middle school education, so it's important that we use plain language that everyone will be able to understand. Effective communication is difficult to measure because it's based on opinion and very biased. One way that it can be measured, though, is through the Press Ganey reports. My nurse manager emails weekly Press Ganey reports to us where we can get feedback on how we're doing. Numerous patients write about either effective or ineffective communication from their stay using these, and we worked well to improve them each week. Some real-life examples that I've picked out of some of the emails I received from nurse manager. Nurse practitioner was rude and just poked her head in for my discharge, told me my EKG had changed from last visit, didn't explain anything about it even though I was there for shortness of breath. Nurses were nice, just kept me in the dark about stuff. I was never told I needed to see a specialist, so I was waiting around for hours and didn't know why. Lack of communication, just letting me rot for 10 hours was completely unacceptable. All of these examples could be avoided by using effective communication. National policy or discharge information is created, edited, and regulated by different organizations. For example, if someone's discharged from the hospital with a cancer diagnosis, they receive an information packet from the American Cancer Association. The same with the American Heart Association with things like CHF and MI. National policy also for doctors to follow up with their patient if they go home on medications or diagnoses. For example, a 22-year-old female is discharged from the hospital with a UTI and placed on Keflex for 10 days. After 10 days are up, it will be required for a doctor from the hospital to follow up with a patient to be sure that they have no more symptoms of their UTI and that they took all of their Keflex for the 10 days allotted. Not only is this effective communication, but will also decrease the readmission rates in the hospital.